So if you're that person who has just been wondering, why is my penis getting smaller by the day? I've been going through many messages. People have been asking, Nurse Grace, my penis is becoming smaller. What might be the cause of why my penis is becoming smaller? Is there something that I can do to help it regain its normal size? So if you're that person who is just wondering what to do and why is your penis getting smaller, then this video is definitely for you. Hi guys, welcome back to Let's Learn with Nurse Grace. If you're new to this channel or you've just come across this channel, my name is Grace Hezekiah. I'm a registered nurse. So if you haven't subscribed, please make sure that you subscribe to this channel. Thank you so much, and let's get to the video. So guys, today I'll be letting you know of why your penis is reducing in size, or why is it your penis is shrinking? Why is it getting smaller by the day? You've been noticing the signs that your penis is decreasing in size, or maybe just your partner has told you, your penis is much smaller than it used to be. Then this video is definitely for you. Please make sure that you watch this video until the end. So you know that penis is a male reproductive organ, and it's normally found in male gender. So it reaches its normal size or its standard level about 18 to 21 years. So if you're less than 21 years, then it means that your penis is still growing. So make sure that you take care of it so that it can grow to its normal size. So when it's erect, normally a penis gets to an estimate of up to 13 centimeters. And when it's flaccid, or maybe when it's not erect, when it's just normal size, then it's about 9 centimeters, just an estimation. But it might be less than that, or it might be more than that. So what are these reasons that can make your penis get smaller, or can make your penis shrink in size? So the first and common reason is aging. So when you're getting older, then it means that the muscles which are found inside the erectile tubules are inside the penis. So when the muscles inside these erectile tubules, when you're aging, it means that these muscles that are inside these tubes, they get to weaken when you're aging. So if they weaken, then there's also going to be a less blood flow towards that area. And if there's a weakening in the muscles within the erectile tubules inside the penis, and if the blood flow to the penis is reduced, then it means that when it reaches a time that you need to erect, then it means that it's not going to achieve a complete erection. So when you're aging, this happens. The muscle weakens and there's low blood supply, and then erection is not going to be complete erection as it used to be when you're not aging. Also, during aging, you get to find that there's decreased testosterone. Testosterone is just a hormone that is found in men. So when there's this decreased testosterone, then it normally affects your erection. So it means that you're not going to achieve a complete erection. And in this time is when you can find that maybe someone is erect, but the size that the penis is supposed to achieve, I've told you it normally gets to up to 13 centimeters, but it might be lower or might be just above that. So if it gets to that, and maybe your testosterone is a bit low, and then when you're trying to get an erection, then you might find that it's not going to be like a complete erection. It's going to erect, but it's not going to be a firm erection. Another cause is weight gain. So if you've just been having a weight gain for the past few maybe years, for the past few months, then you might be noticing something unusual about your penis. And why is this? You might find people saying that those people who have like a very huge or a very good weight gain get to have very small penis. It might happen to some people and it might not happen to some people, but during this time, your penis doesn't necessarily shrink. It gets smaller, but it doesn't shrink. How does it happen? This happens because when you get to gain a lot of weight, especially around your abdomen, you know that the penis is attached towards the abdominal wall. So when you get to like achieve good weight gain, when you get to add lots of weight, then you find that when your stomach like tries to stretch, it will try to pull the penis inwards. So when it pulls the penis inwards is when you get to find that the penis decreases in size. It gets to be smaller than it usually be. You might get to find your partner telling that, you've added a lot of weight and maybe your penis is becoming smaller. This might be the reason. It's not like there's something happens, or like maybe your penis just disappears from nowhere. It's simply because your muscles around your abdomen is quite stretching towards the abdomen, towards the stomach. Then it means that the penis is going to go inside. So that's what happens, and your penis becomes smaller. So if a person loses weight normally, you might find that the penis will definitely go back to its normal size, because I told you that between the age of 18 to 21 is when your penis gets to normal size. So if you're past that age and you try to lose weight during this time, it means that your penis is going to go back to its normal size. So another point is smoking. So the chemicals that are normally found in a cigarette, so in most cases, they get to damage the blood vessels that are within the penis. So if they damage the blood vessels, if they get to damage the area around around the penis, then it means that there are going to be a less blood flow towards the penis. And remember, I told you, if there is less blood flow, then there's definitely going to be no firm erection that you're going to be achieving. You're not going to be achieving a complete erection. So if you're smoking, please make sure that you take care of yourself. You might be smoking and your penis is getting smaller by the day. When you're trying to erect, then you are not going to achieve a complete erection, because remember, initially I told you that already if the blood vessels within the penis are already damaged or they're destroyed, when the blood flow reduces, then definitely you're not going to achieve a firm erection. Another thing is medication. So if you're that person who is taking medication and you've noticed that since I started taking this medication, then, or maybe your partner tells you that it looks like your penis is decreasing in size, or maybe yourself have maybe just tried to look at yourself and you have noticed that your penis is decreasing in size, and at that period you are taking medication, then just remember, then we've got this specific medication that might cause your penis to decrease in size. So for example, one of these medication are antihypertensives. I'm not telling you to stop taking any form or any kind of antihypertensive or any form of medication. It's better for you to try and talk to your healthcare provider, and they're going to be advising more. Or maybe if you're noticing a change since when you started taking this medication, then there's more options for you. Your healthcare provider might try to change your medication, and with this, it's going to help regain the size of your penis or regain the size of your erection. So if you're the one person who is taking medication and you've just noticed, please make sure that you don't stop taking your medication. Just visit your healthcare provider and they're going to be advising you more about this. So the last thing is about prostate surgery. So if you're that person who has just undergone a prostate surgery, maybe you had maybe something with your prostate, like maybe prostate cancer, and maybe you undergone prostate surgery, then there is a possibility that you might have reduced penile size or your penis might shrinkage. This is normally because of maybe during your recovery, maybe during scar formation and everything about that, it might lead to your penis shrinking in size, and therefore during erection it's not going to achieve its normal size. So guys, what can you do about all these things that I've said? There are causes that are reversible. For example, if you're that person who likes smoking, maybe weed, maybe cigarettes, and maybe taking a lot of alcohol, because in some cases a lot of alcohol might also cause damage to that. So if you're that person who is doing that, then it's high chance for you to try and reduce on your smoking and eventually stop it. If you stop it, then there's a high chance that your penis is going to go back to its normal size. And if you're that person who has just noticed your penis is shrinking because of your gain in weight, then it's high chance for you to try and do some exercise so that you can cut down on your weight. And if this happens, then there's a possibility that your penis is going to go back to its normal size. And if it's about medication, please talk to your healthcare provider. They are going to be advising you more. And if need be, then they're going to be changing your medication to one that is more preferable and one that doesn't have any more side effects that are going to make your penis to shrink in size. And about the prostate surgery, then there's nothing much you can do on that, but the doctor might advise on some exercises or some maybe creams to apply on that area. And basically, there are also some procedures that can help with that. If you're that person who is just having these problems, then make sure that you try to follow what I've said, and maybe it will help your penis go back to its normal size. So guys, that is it for this video. Please, if you haven't subscribed, make sure that you subscribe to this channel. Thank you so much for watching, and see you on my next video. Goodbye.